fracture neck of femur. So basically, this is not the topic. Actually, I have to change it. Yes, it is fracture of proximal femur, and your proximal femur is divided into two types: neck of femur, intertrochanteric femur. Intertrochanteric femur. Neck of femur is intracapsular. This is extracapsular. So it is more common in 50 years. It is more common above 60 years. It is more common in female. It is more common in male, and it is associated with mild pain, mild ecchymosis, no, or mild or no ecchymosis, mild shortening, that is shortening less than 1 inch, and mild external rotation, that is less than 45 degree, and tenderness at Scarpa's triangle. Scarpa's triangle is your femoral triangle, and basically it does not unite. Most common complication is non-union here. Non-union is the complication in neck of femur fracture, whereas in intertrochanteric fracture is your more pain, ecchymosis present, more than 1 inch shortening, more than 45 degree external rotation, pain at intertrochanteric line. Most common complication is malunion, right? So this is your proximal femur fracture differentiation, a small intro. Now classification of neck of femur fracture. Neck of femur fracture. It is based on three: anatomical, Powell classification, and Gardner classification. Anatomically, it is basically three types: subcapital, transcervical, basicervical, and above the bad prognosis increases. And Powell's classification is based on, so this is your femur, and this is a reference line we draw. If the fracture line is at this point, we make an angle, we put another line. So this is your Powell angle. This Powell angle is divided into three groups: 30, 50, 70. Angle increases, prognosis decreases. Okay, so this is grade 1, grade 2, and grade 3. So this is your Powell's angle, and this is Gardner's classification. Gardner's classification is based on the trabeculae arrangement. Normally, acetabulum, head of femur, and the neck of femur, these all trabeculae will be in a straight line. Acetabulum, head of femur, and the neck of femur, all this trabeculae, all these line they join means that will be in a straight line. But in Gardner classification, based upon the fracture, how it is changing, let us check. Basically, it is four groups. Trabeculae bend is your 1, and here it is now no displacement, it is incomplete. Trabeculae bends. And here the trabeculae between the head and neck break. Okay, well, here it is no displacement, undisplacement, but it is complete. Whereas here in the grade 3 there will be all three sets, that is your acetabulum, your head of the femur, and the neck of the femur. All these three fracture line will be in a mal alignment. So all three sets of trabeculae not aligned. is your grade 3. Grade 4 is your acetabulum and neck of the femur, acetabulum and head of the femur trabeculae will be in the same line. Neck is displaced. So this is your grade 4. Prognosis is from 1 to 4, the prognosis decreases. So this is about classification. Now, clinical features, groin pain. Here most commonly you will have groin pain. Groin pain, slipping of foot on wet floor, shortening of limb, inability to bear weight. Okay, there will be no leg raise. Okay, now next will be your management. Management is relatively interesting. When we talk about management, you need to remember it is based on age. First, let us discuss about neck of femur fracture management. Then let us go to intertrochanteric fracture management. In neck of femur fracture management, you divide it based on the age, whether they are less than 65 age or more than 65 years of age. Less than 65 years of age, again you divide it into age of fracture, whether it is less than 3 weeks or whether it is more than 3 weeks. If it is less than 3 weeks, then you do closed reduction with internal fixation with cannulated cancellous screw. Cannulated cancellous screw. If it is more than 3 weeks, you do open reduction with screw fixation. And you check in MRI whether it is non-viable head of femur fracture or it is viable head of femur. If it is non-viable, then you would fix the fracture site with vascularization with muscular strip. Basically use Mayer, Buxy and fibular vascular graft. Mayer is your quadriceps tendon. Buxy is your tensor fasciae. If it is a viable fracture, you do viable head of femur fracture, you fix it with osteotomy. You do. There are two types of osteotomy. One is Neck-Murray and another one is Powell. If it is age more than 65 years, you will do replacement. What replacement? It will be hemi-arthroplasty or total arthroplasty. If you change only head and neck, it is hemi. If you do with acetabulum, with head and neck, then it is total. That's all. Okay. So it is normal hip. Previously normal hip you do in hemiarthroplasty. This previously abnormal hip you do total arthroplasty. So this is your neck of femur fracture management. It is your intertrochanteric fracture means you will do two: surgical, conservative. Conservative you do Russell traction and dextro rotation. If it is surgical, you will do proximal femoral nail locking with stabilization screws. So that's all. Thank you.